Thank you, Mr Deputy Speaker. And I want to commend my colleague, the member for Bowman, who cares deeply and passionately about this issue, for moving this motion. I also want to recognise the very good work that my colleague, the member for Hunter, has done, particularly from a regional area and perspective, and particularly on behalf of men who are overrepresented in this cohort. So to both of you, I want to praise and commend the efforts that you've invested to this very important issue, because it's something that touches many people. And I want to also acknowledge that there are a number of groups in my electorate of Monash who do outstanding work: Zero Suicide Community Awareness, the Gippsland chapter and the people involved in that organisation, Donna, the mother of Daniel, who has an organisation named in his honour, Daniel's Wings of Pride, and my own journey through this issue, starting with Lifeline Gippsland as a board member many years ago in my 20s, and serving on the board of Latrobe Regional Hospital, the Flynn ward there, and the very dedicated mental health staff who live with the consequences as well of this issue. In my early 20s, as many young people do, I was touched by two people, Beck and John Michael, who took their lives, and that some 22 years later, I still think of Beck's little sister and John Michael's father at their funerals, and I think about how they're getting on today. Men's suicide is overrepresented in this cohort. Some 75% of people who completed suicide are men. That equates to about 7 men a day as of 2023. We need to do better by husbands and fathers and sons and uncles and nephews and brothers in our community, particularly our regional communities who are, again, overrepresented. And I know it's a real struggle for a number of organisations who do incredibly good work. Just last week I was in Foster at the South Gippsland Hospital, and I want to praise the efforts of community and allied health professionals who do all that they can on scant resources at a state and federal government level, with a number of obstacles in their way. They care deeply, and they're highly skilled professionals who want to make change in this area. The recent Auditor General's report does make clear that what we're doing, with the best of intentions, is not good enough. We have critical gaps in how policies are designed, funded and measured. And this is despite close to $1 billion in taxpayer investment. There's no consistent or reliable way to determine whether these programs are actually having an impact on suicide rates. We need to have clear initiatives where we don't have a lack of clear baseline targets or outcome tracking. We need funding agreements to meet meaningful evidence of effectiveness, and we need to have a system with results that continue to make sure that there's more significant resources in clear line of sight. Because behind these findings is a stark human reality, and that is that around 9 Australians lose their life to suicide every day, with more than 150 daily attempts. That's 1 in 5 Australians experiencing mental health challenges every year. And this is despite decades of focus and growing expenditure with organisations like Beyond Blue, Headspace, a proud initiative that I've supported along the way, Lifeline, who do incredible work as well. We've got national suicide rates that have remained largely unchanged, and I think this highlights the urgent need for a more effective approach. We cannot continue on as we are. Australians deserve a system that prioritises accountability, strengthens community-based support and measures success by lives saved, not money spent. And I know a lot of these organisations live by the smell of an oily rag. When I was involved in Lifeline Gippsland, we would have the op shops across Gippsland. They would have e-waste sales. They would do huge amounts of fundraising to support the incredible volunteer telephone counsellors that save lives and make a huge difference every single day of the week, and I pay tribute to their efforts. Headspace is a great organisation. We've got a Headspace in Wonthaggi and another one in the Latrobe Valley. I desperately am fighting for a new Headspace facility in West Gippsland to meet that growing population need, but I commend the member for Bowman and this motion.